As an organization, we decided from the beginning that the thing that we want to focus on is intense suffering. I mean, that's the name of our organization. But just as a priority to look for sources of intense suffering that are tractable. And cluster headaches have been on our radar screen for a while because, as you know, they are considered to be one of the most excruciating pains that are known to medicine. So they were something that we had in mind to address and certainly to focus attention on. But what happened was sometime last year, we became aware, actually not initially about psilocybin, but about DMT. So a researcher that is on our advisory board discovered that DMT can apparently abort cluster attacks as quickly as within a few seconds. And he was very excited about this and thought that, cluster headache patients everywhere should be able to get DMT. So we started to investigate, and it turned out that that's where we discovered that there's actually a lot more evidence for the efficacy of psilocybin. There are far more patient reports than for DMT. And that doesn't mean that psilocybin can necessarily do everything that DMT can. DMT may well be the quickest abortive for cluster headaches. There just isn't as much evidence and even less that it can actually prevent attacks. Whereas for psilocybin, there's, well, this is something we can talk more about, but there's a wealth of evidence, and basically patients are just not getting the benefits that are available to them. So it was an obvious case of a very large gap between the need and what is actually being done to fulfill that need. So, in terms of a source of intense suffering that can actually be prevented, and where the means are available with low risk, with low cost, with very obvious benefits with little risk. I mean, it just seemed a very obvious case to focus on, where there's a huge amount of potential value to be obtained by doing advocacy in this area. Anything that can prevent attacks from happening would be considered a holy grail by cluster headache patients. Nobody wants to get to the point where they're having to abort an attack. And that's actually what makes substances like psilocybin so incredibly valuable, because if you look at the pharmaceuticals that are currently available, there aren't any that can really consistently prevent attacks from happening. I mean, there are preventatives. There's one well-known one called verapamil, and it seems to be effective in a certain percentage of patients, but in preventing attacks, but it doesn't seem to be very good at preventing entire cycles. So, people will take it and they'll get fewer attacks than they might have otherwise when it works, and for others it doesn't work. But it doesn't have a reputation for, getting people to just stop their cycles entirely. Whereas psilocybin and LSD as well have been found by many patients to really have dramatic effects. I mean, they'll take a couple of doses and then they won't have a cycle at all. Or they may be chronic patients who've been having attacks every day for months and months and years, and then they'll finally try psilocybin-containing mushrooms or LSD. Again, there's more evidence for mushrooms, and they'll find that their attacks stop. So again, this doesn't happen for everyone, and this needs to be, it needs to be studied more carefully to get a better sense of the number of patients that can be helped. But there have been surveys done, and of course, there's always selection bias. Maybe the people that are responding to these surveys are people that haven't responded to other drugs. So there's always a certain amount of uncertainty about just how many people are being helped. But the fact that people are actually able to entirely prevent cluster headache cycles altogether with psilocybin is, essentially essentially incontrovertible. And I mean, this brings up the whole other question of, what constitutes evidence. I think some of the reluctance to fully embrace these substances as powerful therapeutics is the fact that there haven't been randomized controlled trials conducted until now, even though there are 2 that are ongoing at the moment with psilocybin for cluster headaches. But there's such an enormous amount of data from patients who've seen these effects, and it's not just a couple of patients. We're talking about hundreds, thousands of patients who have seen their lives turned around through the use of psilocybin mushrooms and LSD and some other substances like 5-MeO-DALT, which is another related substance where also sometimes some patients have taken just a couple of doses or even 1 dose and it's just wiped out their cluster headaches. I mean, these are incredible effects, and it's not just the occasional anecdotal, piece of anecdotal evidence. I mean, there are huge numbers of patients that have seen these kinds of effects, and this represents an overwhelming case for efficacy. I mean, just to be clear, what we've done is basically taken a look at what studies are out there, and to be honest, there aren't that many. There are a couple of classics, I guess you could call them classic studies, but these are surveys of patients. There was one that took place, I guess, around 2006, I think, and then there was a larger study in 2015 by Manuel Schindler on several hundred patients, and then Larry Shore has been conducting, he conducted a large survey. Unfortunately, I'm not quite sure why, but the survey results haven't been published in the journal, but he's presented them as papers. So the research was done, and he's found, again, he's confirmed the same kinds of effects that were, the same kind of efficacy that was seen in the previous surveys. So, these are, let's say, and there's been some other surveys that have done as well also by the colleague that I mentioned earlier, who called our attention to DMT. He's also been involved in doing some surveys, basically looking on the web and using cluster headache groups and Facebook groups. So there, let's say, a series of these kinds of surveys that have been done, and they all point in the same direction. So from a scientific perspective, if you repeat these surveys and you get similar results, I mean, this just reduces the chance of the effect being due to randomness to, it reduces the probability to an insignificant number, let's say. But in addition to that, we've been looking at patient testimonials in different places, but mainly in cluster headache support groups on Facebook, and from some other sources. And it's just overwhelming how many patients have found relief with mainly with psilocybin when basically everything else has failed. So if you want to look at numbers, I mean, it's interesting. Somebody who I was corresponding with yesterday, who has been writing a report on the treatment of pain for an organization based in the UK, and one of the things that they were covering is cluster headaches. So I was reviewing the report and giving my own suggestions on how to properly capture the significance of cluster headache pain. He asked me actually the question about, what would I estimate the probability of, let's say, psilocybin being effective, based on the evidence that's available. And I did some thinking about it to try to extract some numbers. I mean, obviously these are rough estimates, but so I'm a little bit kind of wary of kind of saying this out loud, because these are really just these are really just very rough estimates, but I would find it, yeah, I think the chance that psilocybin is just simply ineffective and that all the effects that have been reported are just due to chance or artifact are vanishingly small. I mean, when I say vanishingly small, I mean, maybe less than 1 in 10,000, or even less than that. And it's just inconceivable that all these effects are fake, or let's say false, or are invalid. I think the only real question, and maybe just to continue on that point, I would say that I think it's also vanishingly unlikely that the reports where patients have been able to abort entire cycles or prevent cycles with the use of psychedelics, the likelihood of these reports being also due to chance, let's say the cycles would have ended otherwise. Again, I think the probability is, less than 1 in 10,000. I mean, it's inconceivable that all these reports are just simply wrong. Because, let's look at it. If somebody has a cluster headache every single day for months or even years, a very specific example, the head of an association in Finland that we've been collaborating with very, very closely with. I mean, he had attacks every single day for something like 1.5 years, and he took 2 doses of mushrooms, and that was it. So, what are the chances of that happening randomly? What are the chances that his attacks would have stopped anyways? 1 in 100, 1 in 50, and then you take other people who've reported the exact same kind of experience, and you multiply the probabilities of these being by chance, and you get a very, very small number. So the only real question is what percentage of patients can be helped, and there's a certain amount of uncertainty. So in the Schindler paper, 40% of patients who tried psilocybin or LSD found that it was entirely effective in stopping their attacks as a preventative. But again, there may be some bias there. Maybe these were people who were, let's say, more susceptible to being helped by these substances. But I would think that the chance that only, let's say, a few percent of patients can be helped is also extremely small. So overall, my guess is that a fairly large two-digit percentage of patients can be helped dramatically with these substances. I don't remember any conversation with anyone where they actually objected to the idea. I mean, especially when you show people what cluster headaches really are. I don't think anyone's going to say yes, but this is another part of the whole story, which is that even if you're uncertain about just how effective these substances are, if somebody is suffering from indescribable pain and there's a chance that something will work, well, then you let them try it. You remove the barriers. You don't say yes, but we need to be within our 95% confidence interval. And then the only other question is the risk or safety issue. And again, these are substances that are historically known to be safe, in particular the case for psilocybin. And if we're talking about even limiting it to prescriptions by doctors, if we're just talking about treating cluster headache patients without talking about greater use in the population, then we're just talking about the risk-benefit profile for patients. And because the pain that they're enduring is so intense, any risks associated with it are just, trivial in comparison. So there's absolutely no compelling reason to prevent cluster headache patients from being able to access all of these treatments, because some patients may respond better to one treatment than another. So I would say it's not just about making psilocybin available, but they should be able to use LSD. They should be able to get 5-MeO-DALT. Maybe that will work, whereas one of the others won't work as effectively. We really need to remove the barriers so that cluster headache patients have access to anything that might be able to help them. I mean, every independent case of a patient who has been prescribed all kinds of things that don't work and is at their wit's end, and every case like this is compelling in itself. Just an hour ago, I was reading a post by somebody in a cluster headache Facebook group who said that she's basically physically and emotionally in a really difficult place, and wants to try mushrooms, and thinks that she won't be able to last another couple of days if she doesn't get some help. I mean, and I read these kinds of let's say anecdotes, if you like, just continuously. I mean, there's so many people that are in this situation, and they're taking prescription drugs like sumatriptan, and it's just not working well enough for them, and they're still getting cluster headaches, and it's destroying their lives. And so many of them do take mushrooms, and it either wipes out the headaches or reduces the frequency, makes them manageable. I mean, again, there's a range of responses. But when I was reading this particular post, I just felt this almost like a burning rage that why are people like this not being able to instead of doctors being able to say, look, there are these substances that work for so many people, why don't you try them? Instead of that, they're having to look around and ask on Facebook groups, what dosage should I use? Should it be 0.5 gram or should it be 2 grams? And of course, they have no guarantee that whatever they're able to obtain, what the purity is, what the strength is. I mean, this is, when you think about it, it's insane that somebody should be, on the verge of taking their life because the pain is so intense. And there's just so much evidence that there are substances that are effective for many of these patients, and they're basically scrambling for information, scrambling to actually obtain these substances, even though they're very easy to produce. I mean, there's just a complete incongruity between this situation and what would be ethically demanded. I guess without any sort of scientific studies being done, one might think that one associates probably both magic mushrooms and let's say ayahuasca with something of a hippie culture, and all the associations with that. But obviously, what's happened with psilocybin is that there have been so many reports of people with depression and post-traumatic stress disorder and anxiety who've been treated and who have found that psilocybin has actually turned their life around. And obviously, because it's getting a lot of scientific attention, that changes the way that it's perceived by the public, because it gets a sort of stamp of approval from the scientific community, which is obviously a good thing. DMT, well, I mean, when people know, of course, of ayahuasca, and again, ayahuasca retreats have become popular among some people, and people again talk about having life-changing experiences. So I'm sure there's certainly a certain amount of intrigue among the population, and you find out that a lot of people have been sort of investigating or have been on these retreats. I guess a lot of people don't even know that DMT is the active component of ayahuasca. And people that take DMT, pure DMT, will usually be taking it in a different kind of context than ayahuasca. So it isn't necessarily associated with these sort of deep revelatory experiences that people associate with ayahuasca. Although, from what I've heard, people that do take DMT in the pure form have very intense experiences. But I guess getting back to your question, how can we? I think it's a complex issue, and I think we need to separate the different aspects of it. There's the therapeutic aspect, where we're talking about a medical condition and the promise of these substances to help. And this is really what we're trying to focus on right now with cluster headaches. Getting away from all the other questions about let's say the spiritual benefits of taking substances that can create greater insight into life, existence, meaning, and all that. I mean, those are valid things to look at, but we're really trying to focus here on the therapeutic benefits for people with cluster headaches. And I think that in itself is there's plenty of evidence, without even needing to look at any of the other benefits. Just showing people that the medical benefits are clear, I would think should be enough if the information is communicated well to persuade them to give it the attention that it deserves. So, I mean, from a scientific perspective, I would be a little hesitant to draw too strong a parallel between these two sort of strands of research. And I'm sure there will be overlaps, but we may also be finding that that the mechanisms of action are distinct. That the way that that endolamines like psilocybin and DMT work to abort and prevent cluster headaches may be a very specific mechanism that may be separate from the psychedelic effects. And in fact, we know that you don't necessarily need to take hallucinogenic doses of these substances to get therapeutic effects in cluster headaches, which again suggests that the pathways that are being activated, or let's say acted upon, are not entirely overlapping. So it's an illustration of how chemicals can be active in different ways. Sometimes that's negative, where a therapeutic effect is accompanied by side effects. In this case, I just think that it illustrates that there's a very interesting chemicals that act in different ways on the brain. And obviously not everybody who's treating their cluster headache wants to have a psychedelic experience. But there are a couple of points to keep in mind. I mean, one, as I said, is that they don't necessarily need to take hallucinogenic doses. The other thing is that they're often not. They don't often need to be. They often don't need to be taken very frequently. And of course, some people, they consider, okay, it's even if they don't feel like having a hallucinogenic trip, it's still it's nothing compared to a cluster headache. And then there's also the fact that there are substances that have similar effects that don't have the hallucinogenic effects. So there's a derivative of LSD, 2-bromo LSD, that is not hallucinogenic, and limited studies have suggested that it has a similar kind of effect on cluster headaches. So I think I think we need to be a little bit careful about not combining every aspect of these substances into, or let me say this again. I think we need to be a little bit careful to look at the different properties of these substances and to look at them distinctly as well, because in some cases we don't want to be not all the properties are wanted in every situation. But if we look at it more globally, I mean, these are substances that are proving to have a range of benefits, both for therapeutic purposes and for more, let's say, spiritual purposes. So, I mean, you can look at it more globally and think that these are interesting substances with that are really unusual in that respect. I think it's absolutely essential that doctors become aware of the evidence out there and to get past their own particular taboos or stigmas around certain substances because they happen to have psychedelic properties, and also to recognize that there are other forms of evidence besides randomized controlled trials, that patients' own reports is a very powerful source of evidence. So our policy paper has a whole bunch of references that, including reviews on the pharmacotherapy of cluster headaches. So I would say it's a pretty good starting point for exploring and looking up, what's actually been done clinically. And also we have a range of testimonials from patients that give let's say bring to life the actual benefits. And we have, let's say, 4 pages of testimonials, and I don't think one can read through them and deny the evidence. So I guess the main message is to be informed and to recognize the flaws in the system as it is. There's a tendency within medicine and within science to err on the side of conservatism, to wait until we have all the evidence in, and then we can say yes, it works. In cases where patients are in agony, there's a very strong, there's an overwhelming case that they need to be able to try things, even if there are some doubts, even if the doctor has some doubts about whether it will work. And a recent review made exactly that point, that because of the burden, as they put it, of cluster headaches, there's a need to try treatments even in the absence of strong evidence. Which, again, I'm repeating myself, but that's not the case here. There is a lot of evidence, but it's not the kind of evidence that let's say scientists and doctors are used to depending on. But statistically, the evidence is overwhelming.